The surgeon who never stopped, a hospital's open secret. The fluorescent lights of the hospital hallway hummed like a swarm of agitated bees, casting a sterile glow over the chaos unfolding in room 312. It was 11 p.m. on a Thursday when my girlfriend, a seasoned urologist, received the call. Her voice tightened as she hung up another emergency, another mess left behind by him. The patient, a 34-year-old woman named Clara, had been admitted days earlier for what should have been a routine gynecological procedure. Now, she writhed in agony, her face ashen, as nurses scrambled to stabilize her plummeting blood pressure. Foul-smelling fluid seeped through her bed sheets. Clara's sister, clutching her hand, pleaded for answers. She keeps saying it burns, like something's rotting inside her. When my girlfriend examined Clara, the diagnosis was immediate: rectovaginal fistula. A grotesque tunnel had formed between her rectum and vagina, allowing fecal matter to leak uncontrollably into a space never meant to harbor it. The infection was raging, her body on the brink of sepsis. But what horrified my girlfriend most wasn't the condition itself, it was the name scrawled on Clara's chart. Dr. Robert Hargrove, the same OB-GYN who, 6 months prior, had nicked a patient's ureter during a hysterectomy, flooding her abdomen with urine. The same surgeon who'd once stapled a woman's bowel shut during a C-section, requiring a midnight rescue by a general surgeon. The man colleagues privately called the Butcher of St. Mary's, a nickname uttered in break rooms, but never to administrators. The pattern no one acknowledged. Clara's case was no outlier. Dr. Hargrove had a pattern, ambitious, charming, and catastrophically out of his depth. He specialized in taking on complex surgeries, pelvic reconstructions, advanced laparoscope procedures despite a track record of near-fatal errors. He treats the operating room like a playground. My girlfriend fumed later, scrubbing out the sour scent of antiseptic from her hands. But when things go wrong, he just walks away, acts like it's nobody's fault. The repair surgery took 4 hours. My girlfriend worked alongside a colorectal surgeon to excise necrotic tissue, close the fistula, and salvage what remained of Clara's ravaged anatomy. As they closed, the circulating nurse muttered, "Third one this year. When does it stop? A system built on silence." Here's the open secret hospitals won't tell you: medicine runs on self-policing, and self-policing often fails. Dr. Hargrove wasn't some rogue actor. He thrived in a system where reputation trumps accountability. Senior administrators turned a blind eye because he brought in revenue. His clinic booked lucrative surgeries, and patients adored his confident bedside manner. Fellow surgeons hesitated to report him. Medicine's culture of see no evil meant they'd sooner clean up his mistakes than risk lawsuits or departmental drama. Even worse, he wasn't alone. My girlfriend's voice dripped with frustration as she recounted other names: the cardiologist who misread EKGs but blamed nurses for alarm fatigue, the neurosurgeon whose tremor went unaddressed until a patient was paralyzed. But OB-GYNs, she argued, occupied a unique danger zone. Their surgeries involved the most delicate anatomy: ureters, bowels, major vessels, but some residency programs barely train them beyond C-sections and basic hysterectomies. Then they're unleashed on complex cases, armed with arrogance and YouTube tutorials. The human cost of hubris. Clara survived, but her life fractured. The fistula repair left her with a colostomy bag, possibly permanent. She developed PTSD, terrified to let any doctor touch her again. Meanwhile, Dr. Hargrove scheduled his next surgery, a high-risk uterine prolapse repair, the following Monday. My girlfriend's hands shook as she filed the incident report. She knew what would happen. A committee would review it, deem the case a tragic complication, and Hargrove would receive a cursory warning. No suspension, no mandated retraining. The hospital's lawyers had already met with Clara's family, offering a settlement sealed by an NDA. Why patients never hear the truth. This is what doctors don't want you to know. Medicine is a human institution, riddled with ego, insecurity, and institutional rot. Patients assume licensure equals competence, but a diploma isn't a force field against hubris. Bad surgeons aren't always fired, they're shielded by administrators who fear. Bad PR by colleagues who don't want to ruin a career, and by a system that treats patients as disposable revenue streams. My girlfriend still fights. She files the reports, begs chiefs to intervene, coaches patients to ask surgeons. How many of these have you done? What's your complication rate? But she's tired. Tired of stitching up Hargrove's disasters. Tired of watching him stride through the ICU, untouchable, while his victims relearn how to live. As for Clara, she's part of the club no one wants to join, patients who discover too late that trust in a white coat can be a lethal gamble.
Stay safe. Stay angry. Take action. One comment below. Have you or someone you know experienced medical negligence? Share your story. Let's expose these failures together. To like and subscribe. If this video made your blood boil, smash that and hit. We're done letting hospitals hide the truth. 3. Spread the word. Tag someone who needs to hear this. Knowledge is power, and it might just save a life. Resources for patient advocacy and links to patient safety organizations, medical oversight boards, or guides for researching surgeon credentials. Remember, you have the right to ask your surgeon, how many times have you performed this procedure? What's your complication rate? Who will take over if something goes wrong? Don't be a statistic. Be a survivor.